It has to be the funding crisis. All we really need is parity with the NHS. If we could get the same conditions as their workers and the same salaries for our workers, it would obviously make a huge difference. Because there's so many vacancies in the sector, and it just doesn't make any sense to me to keep the funding away from us.
I think recognising its value. I think social care isn't valued at all, and I think it needs to be more seen as more professional and a career rather than a job that anybody can do. It's a very difficult job, quite often on your own, with very high challenges, and I just think it needs to be valued.
I don't think that there's a utopia, but fairness for all, and people need more support than others. So have that, magic wand to allow that, so that they can get out into the community, have enough to live on, and be seen in the community.
It would have social care on a parity with the NHS because they're interrelatable, and so one can't exist without the other. Yet the care sector is treated like the poor relation. It needs funding properly, and then we can work together cohesively.
My biggest dream for transforming the care, it would be that we could plan ahead and that we would have the services in place for us, for everybody, for the people now, and that it's valued by the public and the government, and that it's funded appropriately so that we can plan to make transformational care, and that we can make sure that nobody is left home alone on their own, and that everybody gets the care they need.
A year from now, we would have well-trained staff with adequate funding for care and for wages, and right across the board, improved facilities, and quality of care is what we want. It's not about, the misconception is that care providers earn lots of money and everyone's a millionaire. That's not the case. They're very small margins, and we are on very tight budgets, and we are trying desperately hard to care for the most vulnerable. But we need the support of the government. We can't do this without their support. It's impossible.
I think the biggest challenge that we have is that we're not adequately appreciated or recognised. And what we need is to be recognised in parity with our health service colleagues. We're always seen as the poor cousins. It's all about the NHS. It's all about the NHS 10-year plan with very little mention of what's happening in social care. Yet every expert says that we cannot fix the health services until we fix social care.
I would love to see widespread adoption of new technologies that can really support us to turn the tide on some of the challenges that we've endured over the last kind of decade or so. I think embracing new technology will enable care recipients to receive a more consistent care standard. They can have more choice over their care potentially, which I think is so important for the person who uses the service. I also think it will greatly enhance the experience of those people working within the sector, and overall it would be great to see a shift in the perception of carers and care organisations in general. I'd love to see that change in the next 12 months.
I think everything starts with recruiting and retaining good care workers. So I think that we need to ensure that the sector is funded in the right way so that we can pay care workers properly. And that alone, if we just do that, if we just manage to pay care workers properly, we have the right rates from local government so that it's commissioned in the proper way, then actually the providers can do the rest. We can make sure that we can provide really good services for people. The quality of care, the continuity of care would be excellent. But I think for us to make sure it's funded, and hopefully, the review with Penny Dash is going to happen. Maybe in the next 12 months there's going to be some findings from that, but I think really it all starts with making sure we can fund care in the proper way.
In the UK, I want to make home care more proactive rather than reactive. And what that means for our care recipients, our clients, it means that they're going to have less hospital admissions, they're going to be able to live at home more comfortably, and they're going to be able to thrive at home rather than just surviving. One of the reasons I've got into franchising rather than having a single unit is so that impact can be made across the country at a much wider scale. And I think that proactivity is a real shift in the way we think about social care in the UK.
My biggest dream for transforming care in the next 12 months is to make care much easier for care providers. And that means, on one hand, automate or facilitate anything that's not actually physically caring for patients. And that's what we're doing at Birdie with the technology we're building, establishing the right foundations, rostering, care management, finance, but also investing a lot in AI to make sure we can automate and facilitate as much as possible the care. My second biggest dream to transform care in the next 12 months is to really make home care the new healthcare. And that means helping care providers venture in that journey of healthcare with a range of new services, and technology can be a significant enabler to serve these new patients. Well, if we achieve it, I think it will be a huge difference for the providers we serve. On one hand, it would alleviate the burden that they have dealing with such cost pressure, and this is the backbone of healthcare, social care. Helping them deal with these costs is transformative. So that's how we're going to help them with technology. With technology, quality of care improves. Being able to say that every old adult gets the best care possible at home is transformative and really will help them live much longer, much healthier in their own home.